For months now, every Tuesday and Thursday, we've been joined live with an infectious disease doctor to answer questions about the COVID-19 pandemic.
And this morning, we are once again joined live with Dr. Hawkinson from the University of Kansas Health System. Doctor, thanks for joining us this morning.
Hi. Thank you.
So today you're actually joining Kansas Governor Laura Kelly to talk with teachers from across the state on reopening schools. So many people have so many questions. This has been a very difficult process for families, for school districts. What are you going to be sharing with those teachers?
You know, I'm just going to try to share the most up-to-date and accurate knowledge that we have about the virus. This includes the danger to the students as far as acute infection and long-term complications, which again we don't know too much about, but also the danger, the information to the adults associated with those students. Because it's not just the students. We know there are undoubted benefits of going to school. That is not in question. But it's also the adults associated, whether it's the teachers, the custodial workers, the administrators, but also those adults that the children go home to. So I think there are a lot of details and a lot of issues to address when we are talking about children going back to school. And I'm just going to present really the most up-to-date, accurate information that we do have that has been published in medical journals and other things of that nature, really just to inform people.
And Doctor, just to switch gears a bit, you know, KU Health is in clinical trial using convalescent plasma to treat COVID-19. Would you mind explaining how this plasma could help patients and how that trial is going?
Yeah, so we are in collaboration, or we are still working with them. Now, again, with the emergency use authorization, it's a little bit different, but we have been in collaboration with the Mayo Clinic, and that is with Dr. Wissam Elatrouni here, who's one of my colleagues. And basically, plasma is a blood product. So when you go to, say, community blood center to give your plasma, they stick a needle in you. They get it just like a blood product. Basically, it is from recovered people who have had COVID-19, because we have heard probably about in the news, when you do have the infection, you build up antibodies. Antibodies are very small proteins that your body produces to help neutralize and stop the virus. So you still have those antibodies circulating in your body for at least a few months. We are able to collect those and then give those to patients who now have acute or new infection. And what they have shown is that there has been some mortality benefit from getting convalescent plasma from recovered patients. It just matters really how sick are you, and also at what time frame after the initial infection or the initial symptoms are you getting it. That seems to have some importance as well.
The earlier the better.
Absolutely. If you can get it early on, you are getting infused with these antibodies, which can react with the virus to really try and stop or slow the infection, and then subsequent effects of the infection.
Doctor, we want to ask you about this zero pressure contagion tent that you've been working on, everybody over at KU Med. What is this and how is this going to help? You're telling us this could actually have long-term use?
Yeah, so it's a device, and this was developed by 3 of our critical care and anesthesiologists. It's a device to help people, specifically people who are working in an OR, say an intubation situation. And intubation is when they have to stick a tube down your throat so that they can, you can help breathe by a machine. So basically what this is a device or an apparatus that just goes around the head, so you help protect the people around the person that may need to be intubated, whether it's because of a natural disaster or a man-made disaster, or on the battlefield, or even in the operating room in a controlled setting, so that they are expressing less virus out into the environment, but it's contained in this negative pressure clear apparatus or clear tent, so that they can continue to maintain as much safety as possible to other patients or other people. Say if you're not in the OR, but if you are in the operating room, to other healthcare workers, other physicians, CRNAs, therapists, surgeons, everybody who may be in there. It helps contain it more. That way they are able to do the intubation and get that done quickly and responsibly, and really decrease the amount of virus otherwise expressed into the room and into the environment.
And protect the healthcare workers there. That's fascinating.
Wow.
Dr. Hawkinson,
Yes.
thank you for joining us.
Thank you so much, Dr. Hawkinson.
All right.